Hey guys, this is Rob Price from Primetime Urgent Care, and I just wanted to talk to you guys a little bit today about heat exhaustion and heat stroke and heat-related illnesses. As the weather starts to warm up and we start to get outside more, this is something we see every year. So we just wanted to give you guys some tips and some things to look out for. So heat exhaustion or heat stroke are all part of a spectrum of diseases classified as heat-related illnesses. It can be as minor as muscle cramps and being mildly dehydrated, or it can be as severe as a life-threatening process such as heat stroke. We know some of the biggest risk factors for heat-related illnesses are, of course, obviously heat, also humidity. So this wonderful Georgia summer weather that we have is ripe for this kind of problem, and also lack of acclimation to the heat can be a major factor. Classically, heat-related illnesses are related to physical exertion in a hot environment, and that's what we'll focus on today. Not only athletes as they start summer conditioning and summer camps, summer training, but also the rest of us as we get out and decide to tackle those summer projects, some yard projects, rebuilding that deck, restaining that deck, power washing the house, those kind of things can all expose people to heat. Some interesting information about heat-related illnesses. In the US, football players are the #1 population at risk for this, and it's typically during the first week of their practice in the heat. So this is when we'll see folks either doing a summer camp where they've been inside all summer and they're getting outside for the first time, or the first week or two of practice. This is when the athletes are at most at risk from heat-related illnesses. Some of the different classifications of heat-related illnesses are the mild symptoms, such as heat cramps, to the more severe, such as heat exhaustion, and then to a life-threatening condition called heat stroke, and we'll talk a little bit about those. Heat cramps, I think most of us are familiar with. Typically the body temperature is actually normal or just slightly above normal. And this is considered a pretty mild condition. The treatment is removing yourself from the activity and hydrating adequately. The next condition is called heat exhaustion, and this is a more serious condition compared to heat cramps. And this is when the person begins to have difficulty continuing their exertion. You start to see people, their effort starts to wane significantly. They may have difficulty even standing up or even completing the tasks they have been doing. We start to see this around a core body temperature of around 101 to 104 degrees. The big key here is there's still no change in mental status. The person is awake and alert, not confused, and knows what's going on, but is starting to physically show the signs of exhaustion and dehydration. Some of the symptoms that person may experience would be a heart racing, profuse sweating, starting to get lightheaded, maybe seeing some tunnel vision. Some people will get abdominal cramps or even vomiting. Some people describe heat prickles, which is kind of a cold, prickly sensation on your skin, even though you know you're really hot and you're really sweating. And those can all be signs that you're starting to get into heat exhaustion. The treatment for heat exhaustion is getting out of the heat, getting yourself into the shade, even better, getting into an air-conditioned environment, removing any equipment or gear that may be retaining heat, such as football pads, football helmets, and then chilled hydration, preferably something with electrolytes like Gatorade or some other sports drink. But a general rule of thumb is for heat exhaustion, the mental status should be normal. The patient should not be confused. And you should see improvement within 15 to 20 minutes of cooling and hydration. You should start to feel better. And then the last condition we'll talk about today is heat stroke. And heat stroke is a life-threatening emergency. This is where we start to see evidence of damage to the organs. This is associated with a core temperature greater than 104 degrees. We start to think about this when you see someone collapse. If someone can't even stay upright and they collapse to the ground. One of the keys to this, one of the things to look for is any kind of altered mental status. So any kind of confusion, disorientation, unconsciousness, anything that indicates their brain is not operating properly, we're now worried about heat stroke. This is an emergency. This is the time to call 911. This is the time to seek emergency medical care. But also this is a time to start cooling as quickly as possible. In athletic trainer circles, there's the mantra of cool first, transport second. As soon as you notice these signs, you need to get that person out of the heat, into the shade or air conditioning. You need to rapidly start cooling them. So this is ice packs, ice water. If they're awake enough to drink, get some cold water in them. But you want to actively start cooling. You don't want to wait for the ambulance to get there. You don't want to wait to get to the emergency room. You want to start cooling right now. Or if you have a tub of ice water, you can put somebody in. Or if you have an air-conditioned environment where you can get somebody with some wet towels and some fans blowing on them, you want to work on cooling them as quickly as possible. And then once you start to have some improvement in their temperature, then transport them to the emergency room. So how can we prevent heat exhaustion and heat stroke? Well, we can't control the weather. We can't control how hot it is or how humid it is outside. We can control when we go out. If you have the option of getting your work done or getting your sports done earlier in the morning while it's still cool, or later in the evening, that would be ideal. For athletes, the number one most important factor is getting acclimated to the heat. And so as you start your summer workouts, work your way up, shorter workouts, frequent breaks, frequent hydration, and we see in athletes within 1 to 2 weeks, they can get acclimated to the heat pretty rapidly. They do recommend kind of a minimum workout of about 60 minutes in the heat to start that acclimation process. The other thing is to hydrate before exertion. We actually recommend you get yourself well hydrated before you ever get out there in the heat. So the day before, that morning, you're drinking lots of water, making sure your body's hydrated. And then thanks for watching. I hope this has been informative and helpful for you as you start to think about your summer activities, summer sports, summer camps, or even just those projects around the yard. We here at Primetime Urgent Care and Primetime Pediatrics hope you have a safe summer. Keep yourself cool and hydrated. And if you have any questions, please feel free to ask them in the comments below or on the email address you see on your screen. Thanks for watching.